Guyana sent 10 positive COVID-19 samples to CARPHA in January so that the body could engage in genomic sequencing, a type of genetic analysis that would test for the presence of a variant of concern. It was found, however, that those samples were not any of the variants of concern. Recently, advisor on emerging viral diseases at the Pan American Health Organization, PAHO, Dr. Jairo Mendez Rico, indicated that the P1 variant, which originated in Brazil, was confirmed in Guyana. But the local health authorities have indicated that they have not been able to confirm this.
We have sent 10 samples to CARPHA, or through CARPHA, to get it sequenced. And the results that we have from those 10 samples suggest that it's the normal variant that was circulating. Now, we don't have any evidence of any P1 variant, and that's why this is surprising. Now, whether or not we have variants circulating, that's a different question, because probably based on the epidemiology, as we have said before, severity of disease, deaths, and so forth, perhaps there is variants that are circulating, but we don't have that laboratory evidence. And the only way you can confirm that is when you do the sequencing.
So far, Guyana has recorded over 16,000 COVID-19 cases, and though only 10 were sent for testing, the health minister says efforts are being made to get more samples sequenced to determine whether there are variants in Guyana.
Well, we are going to engage them to see how we move forward. Because obviously if we're sending samples and we are not, the results that we just spoke about, if we're going to get things like that, then we need to fix that before we proceed.
In March, the health minister noted that the local authorities were informed that CARPHA had suspended its sequencing for COVID-19 variants. The health minister was unable to say whether the health authorities were informed when testing resumed, but he emphasized that Guyana will be engaging the body. When the newsroom reached out to CARPHA via email, it was noted that testing for variants had been ongoing. There was no response to the question of when testing was suspended, but press releases from March and April indicated that variant testing was ongoing, and these were sent in response to the query from the newsroom. Reporting for the newsroom, I am Vashani Raghavir.